Welcome back to Jersey Matters. I'm Larry Mendte. When President Trump was stricken with COVID-19, he went to Walter Reed Hospital and they gave him a drug called remdesivir. He says it cured him, and he wondered why everybody couldn't get this drug. Last week, remdesivir became the first FDA-approved treatment for COVID-19. I spoke with Dr. Lewis Nelson, who is a professor and chair at the Department of Emergency Medicine at Rutgers University, and he isn't too sure about the drug.
All right, thank you, sir, for your time. Remdesivir is now the first approved treatment by the FDA for COVID-19 patients. Explain the ramifications of that. What does that mean to people who either have COVID-19 or may get COVID-19?
Well, I mean, once a drug is approved, it becomes hard not to use it. So it's going to become quickly the standard of care for patients who are admitted to the hospital and meet the indications that the drug was approved for, which really means over the age of 12 and hospitalized with COVID. There is also an emergency use authorization for children under the age of 12, but it's going to quickly become the standard of care. The question is whether or not the drug is good enough to be considered the standard of care, which is a different question.
Except that it got FDA approval. What did they base that on?
Well, yeah, the FDA does a very nice job of trying to match a drug's safety and effectiveness with all the other parameters that are required before a drug could be used broadly. It takes into account all of the existing evidence. So they looked at 3 trials, one of which is published in the New England Journal of Medicine and has been broadly discussed. And it showed a reduction in hospitalization of patients with severe COVID disease of about 5 days. It did not show a mortality benefit, but that's okay. I mean, a reduction in hospitalization of 5 days does carry some significant benefit to the person and to the health system. So that in and of itself would be a good find. But the other studies that it looked at did not actually support much of a benefit at all. In fact, the more recent data that's come out has actually showed that there is no benefit.
Yeah, you mentioned a couple of other studies. The World Health Organization mentioned a couple of studies that said, and they came out with a quote that they have robust evidence that remdesivir has little or no impact on COVID-19. And then there was a study just released by the National Institute of Health saying that they were skeptical of the drug based on some studies. So how should people feel about the drug at this point?
There's 2 really big questions when it comes to the use of medications. One of them is efficacy, and one of them is safety. I think it's probably okay to take a little bit of a risk on effectiveness of a drug if it's a safe medication. It may turn out in some populations the drug has benefit, and as long as we don't think the drug is going to do any significant damage, it's probably okay to do these sorts of post-marketing studies using the drug on large populations and seeing if it has an effect, and it may turn out to do that. As best we know, the drug seems to be fairly safe. There might be some small effects on the liver, and there may be some minor adverse effects that people have from remdesivir, but it does not seem to be a particularly unsafe drug. But I will warn that lots of drugs that are found to be safe in small trials, once they're put out into the millions of people who might ultimately get this drug, they do find safety signals that are very concerning that they can't find under the smaller trials that they do for effectiveness.
If I can just sum up your initial answer to that question, you tell me if I'm correct. So if you're in the hospital for COVID-19 and it's a possible fatal virus, and you have a drug that can do you no harm and may be able to help you, there's no harm in trying that, and there possibly could be some good. That's basically what you said, right?
That is what I said, although I don't want to suggest that remdesivir has no harm and is all upside. I don't think we truly know the value. And value, I mean risk-benefit. And I'm taking financial questions out of the picture right now, right? But the risk-benefit balance is what's really relevant here. There's going to be risk. People will be hurt by it. We know that. And there's no drug on the market that doesn't carry some risk. The question is, does the benefit substantially outweigh the risk?
Does the benefit substantially outweigh the risk at this point from what we know right now?
At this point, it probably does, but I don't think we really have the final answer because I think the benefit's going to be very small, right? The risk may be smaller than the benefit, which means it's still going to have value. But if the benefit's that low, then it functionally becomes snake oil, right? And not something that we want to give to people, especially at a $3,000+ price tag per person.
This was promoted heavily by the president after he received this in a cocktail with some other drugs in treatment for COVID-19 when he got it. And he said everybody should be able to get this. And then quickly after that, the FDA approved it. Does that give you pause that that's how it happened?
You know, it's obviously very hard to know. I mean, the FDA doesn't work that quickly typically, so maybe it was already in process to get done. I don't want to be overly speculative on that issue. I do think that the fact that the president got better and the fact that the president got remdesivir are unrelated in my mind. I don't think that from that trial of one person we could say remdesivir helped, right? That's a bit Pollyanna-ish. I think you need large numbers of people to really decide whether or not a drug is safe and effective.
And that's not what I was suggesting. What I was suggesting was the president's word carries a lot of weight with the FDA, who's gets funded by his administration or is part of his administration. And if he comes out and says everybody should be getting this, maybe you're right. Maybe they were going through testing. I guess what I'm asking you is how political is the FDA? And would they approve it based on his word, on him saying he wants?
No, and I read your question that way, and I think my answer really is the FDA doesn't usually work that quickly, so I don't know. I obviously don't know.
Are you skeptical?
I'm skeptical about everything.
That's fair enough.
I have to be skeptical.
I'll let you off the hook at that point. Thank you so much. I really appreciate you spending your time.
My pleasure. Thank you for having me.
Dr. Lewis Nelson, Chair of the Department of Emergency Medicine at Rutgers University. When we come back, she was the small business owner who sued the Murphy administration, and now she's going out of business. We talk with her next.